Yeah, I mean, this is a nuanced question, of course. In some people make the argument in young pets, hey, why are we doing that? Usually we do that for a baseline effect. So, and generally, if I have a healthy patient, certainly I'll usually recommend in an ideal world to get a sample either yearly or at least every other year, so we have a baseline as they move through their life. So, young, middle-aged, older dog, a lot like people, So that's usually how I would recommend if you have a healthy pet with no signs or symptoms. There's so many conditions that we see as pets age that are underlying that we pick up on blood tests. So certainly on those regards, anytime we do anesthesia, we of course always recommend blood tests just to make sure you're not fighting some issue that you don't know about that you can't see on the physical exam. And certainly on ill pets, certainly things like if they're having weight loss, lethargy of unknown origins, if they're having lameness in multiple joints where it doesn't seem like, why is this dog, he's having an orthopedic issue, but he's not spraining he's not spraining his elbows and his knees. There's got to be something more going on. So, but as far as routine blood work, which I think is mostly that question, is usually I'll at least recommend it when they're somewhere between the age of 0 to 4, 4 to 8, and then 8 to 12. And then at that point, of course, anytime there are changes that we need to address, looking for medical issues.